I'm Brittany Lewis with Forbes Breaking News. Senator Ray Lujan questioned FDA Commissioner Robert Califf about the infant formula shortage during last week's Senate Health Committee hearing. The baby formula shortage was spurred by COVID-19 related supply chain issues and a voluntary recall of baby formula from Abbott Laboratories. The New Mexico senator spoke about the impact the shortage is having on rural America. Lujan said for these communities in particular, this shortage is, quote, not merely an inconvenience, but a crisis. Listen in for the FDA Commissioner's response.
Thank you, Mr. Kane. I want to thank Chair Murray and Ranking Member Burr as well for holding this important hearing, and to Commissioner Califf for joining to share your insight and answer these tough questions, sir. Thank you for being here. Now, I, like many of our colleagues, come from rural parts of America, and that's where my question began, sir, is in rural regions of New Mexico, picking up the formula needed to feed our infants isn't as easy as going a few blocks to the closest grocery store. Many families have to drive hours to be able to take that trip to purchase infant formula. And when the supply chain fails and essentials are not available, it is not merely an inconvenience, but a crisis for those living in rural and underserved communities. Commissioner Califf, on May 10th, the FDA released a statement saying that the agency is, quote, compiling data on trends for in-stock rates at both national and regional levels to help understand whether the right amount of infant formula is available in the right locations, and if not, where it should go. My question is this. Is this system equipped to track the availability of formula in rural and tribal communities, some of which do not have access to broadband?
Thank you, Senator, and it's good to see you back looking good, too. What I'd say is the system is better than anything we had before. We asked for funding for a system to track this back at the early phase of the pandemic. We got no funding. We took money from other things, which I want to emphasize again, means that other things are not getting done. And we built a system which does give us some data, but not the data that we would really like to have down to the level of the individual location. You know, soon there will be broadband in every community, as you know, thanks to the good work that you all did to get the bills passed for that, but we don't have that now. So we're following at the granular level that we can. And as I've made the point before, the industry actually has very detailed data about where its products are going. We have no right to compel the industry to give it to us, and no right to demand increase in production until the President put in place the Defense Production Act. And so, you know, the answer would be yes, we have a system. It's nowhere near what we need.
Well, I hope, Dr. Califf, that everyone's listening to that, and that the staff that you have here, we can work together to remedy that, make sure that the tools are in place for tracking, and then work with your staff to incorporate rural communities and tribal communities as well. I really appreciate that, and we have some work to do there as well, sir.
Yes, sir. I just might add, over the last 5 years, I've written a number of academic papers about rural health. There is a disturbing drop in life expectancy in rural America compared to urban that we all need to pay a lot of attention to.
You're spot on, sir. I appreciate that reminder. Now, the shortage of infant formula comes as New Mexico is experiencing the largest wildfires in our state's history. On top of the loss of their homes, cars, and livelihood, some New Mexicans are now struggling to source the formula they need to meet the nutritional needs of children. How is the FDA taking the impact of this disaster into account as they advise the federal government on the distribution of formula?
Thank you for that question. And having lived in San Francisco the last 5 years, the wildfires are quite an astounding thing that's hard to appreciate unless you see the size of these fires that we're now experiencing. I just want to make the point that the supply chain part of what we do is an HHS-wide and involves all other parts. It's an all-of-government effort, and I do want to commend colleagues around government. So they're constantly getting reports of where the shortages are and directing product to those shortages. And any area experiencing a shortage due to wildfire where people can't get around, please get in contact with HHS to make sure that they're aware. But I'm pretty sure they've got active feelers out to get this information.
Well, that's a good reminder to reach out to Secretary Becerra as well. And Dr. Califf, to everyone that'll listen, I remind them that this fire was started by the U.S. government. It was a controlled burn started by federal employees, by the U.S. Forest Service. And so we just want to make sure that there's attention on this one. But that's an important reminder. The other questions that I have, Mr. Chairman, I'll submit them into the record, but I'm hoping that we can do more in non-English language education and outreach, namely Spanish and into Native American communities, where in most areas across the federal government, we're still failing in that area, but especially with educating families to earn their trust back, to say these are safe products, this is where you can get them, and this is how to do it. So that's one area I look forward to working with you on as well, sir.
Thank you. That's a good example, by the way, of the labeling issues that we're facing as we import. So a lot of logistics here that have to be coordinated. Thank you.
Thank you. I yield back. Thanks, Chairman.